Hello, my name is Joelle Hawman, and I am a Human Kinetics student who completed my fieldwork placement at the Alpha Center in Regina. The special project that I worked on throughout my time at Alpha looked at if Chinese checkers tables is a reliable and valid way to measure dexterity. At the Alpha Center, the professionals work together by providing a multidisciplinary approach to treat and heal injuries. They treat a variety of injuries including sports, work-related, motor vehicle accidents, musculoskeletal injuries, joint pain, and more. My supervisor is a certified exercise physiologist, and together we administer exercise assessments and create exercise prescriptions to heal our patient's injury. Throughout my time at Alpha, I worked with a variety of patients with many different types of injuries. At Alpha, we see a variety of patients that have injured their wrist, hand, or finger, and as a result, I noticed that there were very few types of measurement tools and exercises that worked on improving dexterity in these types of patients. Dexterity is essential for completing day-to-day activities and is known as coordinated movements in order to complete precision tasks. Therefore, I decided to create a modified version of the Minnesota Dexterity Test to test whether it is a valid and reliable way to measure dexterity. In the research project, my supervisor and I decided to test both reliability and validity. We wanted to see if our test would have consistent results among evaluators, participants, and test administrators, as well as if the test measured what it was supposed to measure. For our project, we created a modified version of the Minnesota Dexterity Test. The Minnesota Dexterity Test consists of a series of 5 protocols in which the participants retrieves, manipulates, and places checkers according to a pattern. We modified this test by only having our participants complete one protocol, placing. In every session, I began by collecting information on the participants' current pain, their current symptoms, and the amount of numbness they currently have. To measure their pain before and after, I used the Matheson Functional Pain Scale, which ranged from 0 to 10, with 10 being the greatest amount of pain. For my study, I had 2 participants that both have wrist injuries. My participants were Darren and Nina, who both acquired their injury as a result of their job. The protocol I created for each participant was to pick up and place 24 checkers from one end of the checkers board to the other side 4 times. Not only were the participants required to pick up the checkers, however, they had to place the white checkers on the white color and the brown checkers on the brown color. For each trial, I recorded their time and compared their results to test the reliability and validity of the measurement. I discovered from the results that the checkers table is a reliable and valid way to measure dexterity, and can therefore be used to treat and improve an individual's dexterity. This is what we had hypothesized at the beginning of the project, and that the protocol is similar to what is used by Matheson's for the Minnesota Dexterity Test. Since the study was not official, there were a variety of variables that could have affected our results. We had tried to avoid these limitations by testing our participants throughout my entire placement and more than once a week. The results of the study will benefit the agency in that the exercise therapist can use the checkers table to measure and treat the dexterity of patients with wrist, hand, or finger injuries. I also gained skills in that dexterity is an important aspect in completing everyday life and should be considered when creating exercise programs. If I were to do this study again, I would have had more participants, had them come in more frequently, and use more protocols from the Minnesota test. Throughout this project, we were able to gain a lot of important information that will benefit both my fieldwork supervisor and I in the future.